Hi everyone, my name is Valentina Zapata and my topic is Step Up Therapy in Black Children and Adults with Poorly Controlled Asthma. First, definition. Asthma is a common lung condition that causes sporadic breathing difficulties. It often starts in childhood, although it can also develop in adults and affects people of all ages. There is currently no cure, but treatment can help control the symptoms. Patients can live full and rewarding lives with the right treatment and management. Asthma is caused by the swelling and narrowing of the tubes that carry air to and from the lungs.
Hi, I'm Dr. Rena Ziade. When it comes to taking care of asthma, there are three things that are very important. Always have your medicines on hand. Know how to use your medicines to control your asthma symptoms. Know how and when to get help when you need it. Working with you as a team, we at Children's Hospital of Pittsburgh and Children's Community Pediatrics can help you keep your asthma under control. Here's more information about what asthma looks and feels like from asthma specialist Alvin Singh.
If you're going to try to control your asthma, it's very important that you know what asthma is and what it looks and feels like. So let's talk about what happens when you breathe. You breathe air in through your mouth or nose, it goes down your windpipe or trachea, and then to your lungs through various sized airways. In asthma, a trigger of some sort causes the airways to become inflamed, swollen, and filled with mucus. This causes obstruction of the airways, which makes it harder to get air in and out of the lungs. Your chest might feel very tight, as if someone is sitting on it. You may cough a lot and also have trouble keeping up with your friends during sports or other activities. You may also notice a whistling sound when you breathe, which is also called a wheeze. These symptoms can occur during the day or at night. Some people who have an asthma attack say it's like trying to breathe through a straw. Other symptoms include rapid breathing, breathing with the shoulders, and flaring of the nostrils. Smaller children can have rapid breathing as well, which can sometimes cause the skin around the neck and the ribs to be sucked in. Any child can have the symptoms described above with a cold, but if the same symptoms keep coming back more frequently, you should think of asthma as a possible diagnosis and see your pediatrician. Asthma can be brought on and made worse by different things. Allergies, which are accompanied by sneezing and runny nose, can also make asthma worse. Seasonal allergies can also make asthma worse depending on the time of year. Various allergens, such as dust, grass, ragweed, and mold, can make asthma worse. Other triggers, such as changes in weather, crying or laughing very hard, and the common cold can make asthma worse as well.
Hi, I'm Linda Earhart with the American Lung Association, Program Manager for Pennsylvania Asthma Partnership. I hope you found these videos helpful. For more information on how to stay healthy and gain control of your asthma, you can visit these websites, chp.edu or paasthma.org.
Applications in medicine. Morbidity from asthma is disproportionately higher among Black patients than among white patients, and Black patients constitute the minority of participants in trials informing treatment. Data indicate that patients with inadequately controlled asthma benefit more from addition of a long-acting beta agonist than from increased glucocorticoids. However, this data may not be informative from treatment in Black patients.
Kevin never wheezes, so I know his asthma isn't a problem. What do you mean?
Many children with asthma never have wheezing, at least that you can hear yourself without a stethoscope. Symptoms from asthma occur when the muscles surrounding the breathing tubes squeeze and tighten, which makes it very difficult to get air inside the lungs and body. For many children, their only symptom may be coughing. Other common symptoms include shortness of breath, difficulty breathing, chest tightness, and wheezing. Every child with asthma is unique and has their own symptoms which may differ from other children with asthma. In addition, each child may have different symptoms depending upon the day and what triggered their asthma symptoms at that time. A late sign of asthma is when your child uses their rib muscles or neck muscles to help them breathe, or they become very short of breath. If you see this means that they are working very hard to breathe, and they need to be treated with their rescue medicine immediately. You may also have to take them to the emergency room, as they can become very tired if they breathe like this for too long.
Wow, I didn't know all of that. Thanks. I'll really make sure I pay attention the next time my child coughs.
Some pictures about asthma in children. And now, pros and cons. Pros. Adults respond best to addiction of a long-acting beta agonist, whereas children respond equally well to increasing the dose of inhaled corticosteroid. This treatment can reduce the mortality in Black children. Cons. Young children also are the greatest risk for side effects with higher dose of ICS. It is expensive and it is not available in all hospitals. Issue applied in Ecuador. We conducted two prospective, randomized, double-blind trials, and one involving children and the other involving adolescents and adults. In both trials, the patient had at least one grandparent who identified as Black and had asthma that was inadequately controlled with low-dose inhaled glucocorticoids. We compared combination of therapy, which include the addiction of LAVA, salmeterol, to an inhaled glucocorticoids, fluticasone propionate, step up to double to quintuple the dose of fluticasone or both. The treatments were compared with the use of a composite measure that evaluate asthma exacerbations, asthma control days, and lung function. Data were stratified according to genotype, African ancestry.
My name is Dominique Hill, and asthma runs through my family. My sister has it, my mother has it. I've lost a best friend to it, and now my daughter has it, and I'm scared I might lose her one day.
I'm Jake Cohn, and I've had severe asthma since birth. My lungs are extremely scarred from asthma and from all the steroids, and my whole childhood just severe coughing spasms and asthma attacks have damaged my lungs.
Jake's been a big challenge. For Jake, we've had to use everything that we've learned from clinical trials to bring innovative new treatments, medications, procedures, lifestyle changes. What is the next thing we're going to offer him?
I am scared, I've been scared since she was 3 months. I could tell she was having trouble breathing and she started turning pink, and I got somebody to bring me to National Jewish, and luckily we made it here just in time. It's just a really scary feeling with a 15-month-old. I'm scared to wake up to my child not waking up in the morning. She's only a baby.
Boy, Kayla's really young to have such a severe case of asthma. She's already been in and out of the hospital. She's had several life-threatening episodes. There could be speed bumps along the way. And what I'm really concerned about is the next speed bump could cost her life. When are we going to get to a cure for asthma? And people like Kayla and Jake have more options.
I'm hoping for Kayla that she's able to grow up and be able to play and run like the other kids.
Skiing's my life. It is physically demanding. I get out of breath every time I ski.
Well, for somebody like Jake, it's just absolutely amazing to me what he's been able to accomplish. We need more research, we need more investigation, we need to study people like Kayla and Jake, and National Jewish is a perfect place to do that.
Never say you can't do something because of your asthma, and never let it get in the way of your passion.
Conclusion. In contrast to Black adolescents and adults, almost half the Black children with properly controlled asthma had a superior response to an increase in the dose of an inhaled glucocorticoid, and almost half had a superior response to the addition of a